Welcome to a study visit at Veloy's Workplace HIV/AIDS and TB program. For over 36 years, Veloy has been a leading supplier of quality lubricants and services to Thailand, the Asia-Pacific region, and beyond. A significant part of our success has been not only our business model, but our conviction that a strong and healthy workforce will lead to progress in the workplace. As such, we have implemented an HIV/AIDS and TB program in the workplace that addresses the physical, mental, and emotional well-being of our employees and the people living in the surrounding community. Let's first take a look at the reasons why we have such a program at all. We believe that in order to provide good governance in the management of the businesses of today, healthcare must be considered a part of good governance. Secondly, the company considers its human capital an essential component of quality maintenance. Employees must be healthy both physically and mentally to operate at their best capacity. Attention to HIV and TB will also reduce the risk of disease in the workplace and provide additional moral support to employees. Overall, we want to create a work environment that is based on love, care, and compassion. Additional reasons for paying attention to HIV and TB in the workplace include preparing for the future realization of the ASEAN Economic Community 2015 and responding to the cases of HIV in Samut Sakhon province, which occur principally among 20 to 30-year-olds, most of whom are workers. Before designing and implementing activities, Veloy organized a brainstorming meeting to explore what are the problems and the base direction to support employees' health, including HIV and TB. This is the mind map from that session. We believe that this is a cycle of issues that leads to HIV, TB, and other opportunistic infections. Poverty leads to a lack of educational opportunities, forcing people to find employment without the necessary preparation to adjust to the structure and culture of the working life. This difficulty then leads to increased stress that often results in alcohol use and drug use. Substance use increases the likelihood of unprotected casual sex and puts a person at greater risk of getting HIV. Our implementation framework is based on the idea that the main causes of the problem are alcohol and drug use. We could foresee the individual and social consequences of these causal factors, so the well-being of our employees was considered vital in the design phase of the program. By promoting healthy lifestyles, healthcare, and treatment, we hope to break the cycle of poverty for Veloy's employees. The HIV and TB Prevention and Management Program is our pilot health project for our community. There are certain factors that contribute to successful implementation of a workplace HIV and TB program. Management needs to, principally, understand the importance of the issue. Secondly, HIV and TB policies specific to the workplace must be defined and enforced. Thirdly, there must be a working group or person responsible driving this program. And lastly, the participation of relevant government and private agencies and networks will facilitate the implementation process. A defined work plan with a clear budget is a determining factor in obtaining required agreements and approvals. It also makes it easier for the committee managing the workplace HIV and TB program to monitor and evaluate the progress of the project. We have an HIV/AIDS policy as well as a separate TB prevention and management policy in the program. The policies are guided by the three principles of human rights, prevention and education, and lastly, care and treatment. For a detailed look at the policies, please see the handouts that have been provided. With our network of external partners, we work with 19 organizations from many sectors. For example, the health sector, the education sector, the private sector, the Chamber of Commerce, local authority organizations, NGOs, and others. Collaboration among partners is used to support each other through information and experience exchanges. This is the organizational chart of the Working Committee for the Workplace HIV and TB Prevention and Management Project. We believe that having a formal structure and a clear direction of responsibility will make it easier for employees to be well, especially with respect to HIV and TB prevention, care, and treatment. From this slide onward, we would like to share some of our activities related to HIV and TB prevention in the workplace. The program has different foci: implementation in the workplace and community outreach. The first objective for implementation in the workplace is orientation and pre-testing of HIV and drug knowledge of new employees. An important part of this objective is the distribution of condoms. The company implements HIV and TB policies at both organizational and departmental levels in order to ensure that all employees are involved in HIV and TB prevention and response. Monthly meetings between committee members are held in order to monitor the progress of the implementation and evaluation plan. For employees, HIV and TB trainings are provided monthly and annually on company grounds. Additionally, peer leaders receive HIV and TB trainings outside of the workplace and attend field visits related to HIV and TB counseling with government and non-government agencies like the Thai Red Cross and the Thailand Business Coalition on AIDS, TBCA. Communications initiatives are a necessary part of the workplace implementation strategy in order to disseminate information and receive feedback and questions from employees. Veloy has many activities and resources in the workplace that allow employees to learn about HIV, TB, and other health issues. The initiative uses different strategies to facilitate the learning of employees on various issues. Apart from HIV and TB, the company also seeks to promote the general physical, mental, and emotional well-being of all of its employees. Moral support activities are also needed to tighten the relationships between the employees. These activities have enhanced the level of trust between supervisors and employees and ensured the turnover rate and number of sick leaves are low. As alcohol and drug use are the main causes of the problem, we emphasize anti-alcohol and anti-drug activities and the rehabilitation of our employees who seek help for their drug or alcohol troubles. Through the promotion of reproductive health in the workplace, we hope to make sure that companies are free of all sexual and reproductive health issues. On the premises, counseling is also provided for HIV, TB, and other health concerns. Furthermore, for employees who have TB, an area has been dedicated to help them manage their treatment plan. It is very rare for companies or workplaces to invest their resources in employees who have TB. The HIV and TB Management Program has an established fund that comes from the company supporting budget, the recycling program, and from the selling of used supplies. In addition, the program is supported by funds from external organizations. Outside the workplace, community outreach is achieved through a network of HIV and TB prevention and response activities. With government agencies, we have frequent meetings to discuss our collaboration. In other workplaces within the community, we create supportive HIV and TB prevention and management networks and memorandums of agreements to guarantee a healthy business community. Our community outreach efforts continue at schools and with out-of-school youth. For the general community, we hold activities to provide information on health, HIV, and drugs. The migrant population exists as an integral part of the social and labor communities of Samut Sakhon, and Veloy actively promotes outreach activities for migrant workers. After much work, we have received recognition of our efforts. TBCA selected Veloy as a site for their Learning Center for Prevention of HIV/AIDS and TB and Management of the Infections Within the Workplace project. The Learning Center seeks to encourage trainers, employees, and members of organizations and the community to exchange information and experiences related to HIV and TB prevention and management. A handout has been included if you would like to look at the guidelines further. Veloy takes very seriously our responsibility to our employees and to the people living in Samut Sakhon. We hope that our program can serve as an example for other people and companies and show that an HIV and TB prevention and management program can be effectively implemented in the workplace. Our work in HIV and TB has not yet ended. For the future, we first hope to advocate further for HIV, TB, and other illnesses in the workplace. The goal will need to be achieved in order to fulfill one of the International Standard Organization's, ISO's, requirements. Secondly, we hope to establish a Sentinel Surveillance Center in Samut Sakhon. Mr. Witawat Bunyasatit, Veloy CEO, has the following philosophy. Giving never ends. There's nothing better than supporting employees and cooperating on social responsibilities. There's nothing better than to give because the return is greater than what we are given. We are ready to strongly move forward in parallel with global changes in our commitment to respond to our employees and society. What would Global Fund like to see happen with HIV and TB? Thank you very much for coming. And thanks to the Professor Somboon Wacharotai Foundation. For 10 years now, this foundation has been motivating us to care for our employees' well-being, and we would still need help to tackle AIDS together.